Hi, I'm Dr. Jacobson. I'm going to provide you with golden advice for passing the ADEX exam, and in this video I'm covering the fixed prosthodontic portion of the exam, which is the crown and bridge. To provide you with my background, I'm a native Spanish speaker, and I graduated dental school in 2015 from Case Western Reserve University School of Dental Medicine, where I also received my MPH. After this, I completed a general practice residency at USC and spent over 7.5 years working at community health centers. I've also been a clinical assistant professor at UCSF, CNU, University of Maryland, a curriculum consultant for 2 dental schools, and I'm the author of Clinical Dentistry Daily Reference Guide. This book is a one-stop resource loaded with critical information for day-to-day clinical decision-making. I wrote this book to help dental students and dentists better navigate the complexities of dentistry. Disclaimer: this video does not guarantee a passing score. A quick overview of the ADEX exam. The CDCA Reb administers the ADEX Clinical Dental Licensure Exam. ADEX stands for the American Board of Dental Examinations. This exam includes a written component and a simulated clinical examination on the mannequin, which is made up of 4 parts: the periodontal or scaling and root planing clinical exam, the restorative portion, the fixed prosthodontic portion, and the endodontic clinical exam. Okay, let's get started. How did I prepare? First, I read the manual. Next, I watched every YouTube video out there about this part of the exam. And then I created my own procedural checklist. I then ordered the teeth online and purchased enough teeth to practice every procedure 6 times. I'm not saying this is what you need to do. You might be fine practicing less times, but this worked for me. Every time I practiced, I learned something new and added it to my checklist so that I could always improve. These are the topics I will be covering: the supplies needed, crown steps, and bridge steps. First, supplies needed: container, digital clock, mirror explorer. The next couple slides I provide you with the list of supplies needed. So as you can see, I have the supplies needed for fixed. In following slides, I'll show you the burrs that I purchased. I included the list of lab items such as the alginate bowls and alginate and microstone. That's if you intend to pour the models and evaluate your crown and bridge prep for any undercuts and path of draw. I ended up not doing this, but I wanted the option. I listed in red what is not permitted, along with the items you need to order on the acaddental.com website to practice. These are some additional supplies you need, such as your loupes, eye protection, passport and driver's license. It's good to have medication with you just in case you're not feeling well, because it's a very long exam. Here's a photo of Jiffy cups, discs. I don't have a photo of the points, the fender wedges, and the diamond and carbide burrs I used. An up-close photo of the diamond and carbide burrs I used. I've labeled the burrs. In this slide, you can see the 7 burrs that I used for the crown and bridge prep, along with their indications. Here you can see in the photo, I purchased a burr block and placed all 7 burrs in there. And after practicing, I learned you really want to use coarse burrs because that will save you time. The other thing is you want to make sure you're not at the high speed when you're using these burrs. You want to lower the speed. This way you won't overheat the teeth and burn the teeth. When you burn the teeth, it looks like a burnt marshmallow. And a student just told me they failed the crown and bridge just because the adjacent tooth had some burn spots, some marks, some black marks on that tooth. Even though she did a good job and passed everything on that crown and bridge prep, she has to retake that part of the exam, which I believe is $1,000. So make sure you don't burn the teeth. I recommend purchasing an orthodontic mirror to use. This way, instead of hovering over the teeth with a small mouth mirror, you can look in the ortho mirror and close one eye and check for any undercuts and check the path of draw. Here's a photo of the lab supplies if you intend on making impressions and pouring up the models. Here are the fixed supplies, including that ortho mirror. This is how I organized my supplies for the clinical exam. And please don't make the mistake I made of leaving your supplies in your car. My car was broken into, and I lost $16,000 worth of supplies, including my loops, the hand pieces, the plastic teeth, the typodont, etc. So don't make this mistake. Next topic, crown steps. First, read the manual. I recommend writing out all the dimensions and drawing it out, and then writing the steps. As you can refer to this, you're allowed to have drawings and notes written in the manual that you take to the exam. You're just not allowed to have additional papers. Make sure that you read every word in this manual. Again, feel free to screenshot this. This is the drawing I made for the crown prep guideline for the number 9 ceramic crown preparation. And if you're wondering what the symbols are, I have greater than, less than, and those two lines are parallel. So parallel to less than or equal to 12 degrees. Everything in blue is what you want. You want to avoid being in the red. I know this slide is horizontal, but this was my attempt at enlarging it as much as I could so that you could see what's on my checklist. But I'll go over this in the next slides. I recommend making 3 putty matrices. You need at least 2, but you can use the third as an extra in case it doesn't turn out well. For the putty matrices, make sure you tap on the buccal and lingual so that it adapts to the teeth. The first putty, you will slice buccal to lingual in the middle of teeth number 2, 6, 8, 10, and mesial to distal. In the second putty matrix, you will slice buccal to lingual in the middle of tooth number 3, 5, and 9. And then you need to check the fit of all the putty pieces to verify that it is perfectly adapted. This step is critical because you might make your putty matrix, slice it, and then try it on, and it might not be touching or perfectly adapted to the facial and lingual surfaces of the teeth. You might have burn through, and if you have any burn through, that means where the tooth was actually touching the inside of the tray, you will have missing anatomy. You will not have captured the contours of the tooth. And you might not have had the putty reach into the depths of the pits and fissures. This material is expensive, and you don't need excess material covering the hard palate and the entire arch. Really, you only need to fill the tray from tooth number 2 to 11. And make sure when you insert it in the mannequin or the simulated patient that the handle of the impression tray is perfectly centered to the midline of the mannequin's face. Insert the tray. And you want to be familiar with the setting time of the putty. And again, you want to make 3 putty matrices. Take out your scalpel and carefully and neatly begin to slice the putty. Here you can see the teeth numbers listed where you need to make the slices for putty number 1 and putty number 2. In addition, putty number 1, you have to slice mesial to distal in the center of these teeth, along the incisals and the occlusals. With putty number 1, you will be left with some additional pieces that you will not need for the exam. So after you make the putty matrices and you slice them, this is when you need to check the fit of all the putty matrices before we even begin prepping the teeth. Try on the lingual putty. Make sure it's perfectly adapted. Try in every putty, making sure there are no gaps between the teeth and the putty. And look carefully. On the posterior teeth, it must be perfectly adapted and reach all the pits and fissures, because you will be using this as a reference point once you begin prepping the teeth. Here are some more photos. Checking the adaptation, making sure it looks perfect. Okay, let's begin prepping. Here are the steps for the crown. First, we will prep the incisal, followed by the facial cervical third, facial incisal 2/3, lingual incisal to the cingulum, interproximal, lingual wall cervical to the cingulum area, connect the chamfer on the facial and lingual, and then refine and polish. All right, for the number 9 ceramic crown prep, first make sure you're prepping the correct tooth. If you prep the incorrect tooth, that is an automatic fail. Begin by creating depth cuts, 3 depth cuts on the incisal edge that are 1.5 millimeters deep. And then we will check with the putty and the probe to verify. Checking with the perio probe. I like using the wheel diamond burr. This way I can make sure it's cut evenly when you connect the depth cuts. Place the putty matrix on the tooth and then again measure with the perio probe. Facial, cervical third, followed by facial incisal 2/3. Something you want to keep in mind when you're prepping the teeth is the thickness of the burrs you're using. So make sure to measure these burrs so you know how deep to bury the burr. Make sure to stay supragingival, less than or equal to 1.5 millimeters. The chamfer should be between 0.5 to 1.5 millimeters. And then we will prep in 2 different planes the facial of number 9. Okay, create depth cuts on the cervical third of the tooth, followed by the incisal 2/3. It's hard to tell in this photo, but these are actually 6 depth cuts, not 3. In red, I have the incisal 2/3, and in black, the cervical third. When you prep the cervical third, you need to be careful with the angle of your burr. Don't create an undercut by following the curve of the tooth at the cervical 1/3. We cannot have any undercuts on these preps, and only prep these 2 planes. connect the depth cuts. Measure with the perioprobe. It's not enough to measure just one part of the tooth. You have to measure the entire surface that you prepped. Here I'm measuring the mesial half of the tooth with the putty in the center of the facial. Here I'm measuring the cervical third. And then use the other putty to measure the distal half. Measure the incisal reduction. 1 to 2 millimeters is acceptable, but if you prep too much on the facial, it'll appear as if the incisal edge is more lingually positioned. So make sure to hover with your mirror so that the incisal edge is in line with the adjacent teeth. Now we'll prep the lingual, incisal to the cingulum. Begin by creating depth cuts, again with a flat diamond burr. And then connect the depth cuts. Check your reduction with the putty and perioprobe. Interproximal reduction. For this part, I recommend using the fender wedges. However, fender wedges are not bulletproof. You can still drill through the fender wedge, but it does provide some protection. Secondly, make sure you do not over taper. The tooth must be parallel or to less than or equal to 12 degrees in taper. We're not supposed to over taper our preps because this will lead to a crown that is not retentive. Here's a photo of me prepping the distal interproximal with the fender wedge. Prepping the mesial, holding the burr as parallel as I can to the lawn axis of the tooth. Something you have to look out for is making sure you don't over prep, because we will measure the axial reduction on the mesial and distal. So keep that in mind. Check with the putty and perioprobe. Okay, look carefully here. Axial reduction must be 1 to 2 millimeters and parallel to less than or equal to 12 degrees. If you look closely on the mesial, I'm measuring with the perioprobe, and I have 3 millimeters, nearly 3 millimeters of axial reduction. So this would be a fail. This is why it's so important to practice. Every time you practice, you will learn something and you will get better. You will not get worse. Lingual wall cervical to the cingulum. Create 3 depth cuts and connect them. We need to keep greater than 1 millimeter of a lingual wall. I remember this being challenging when I was practicing. For this reason, you may have to make the margin of the prep equigingival. And make sure you do not create any undercuts. Check with the putty and the probe. Cingulum. For the cingulum, I really liked using this burr. It's called the KS5 Diamond Teardrop burr. It's different than a football burr in that it actually looks like a teardrop. And for me, it was the perfect shape for creating the anatomy I needed in this part of the tooth. Check with the putty and probe. Slide the perioprobe along the lingual surface of the crown prep, making sure you have at least 1 millimeter of reduction. Also, make sure you have greater than 1 millimeter of height on the lingual wall. That's the part. Connect the chamfer. Here are the burrs that I used again. For this part, we have the flat diamond burr and then the end cutting diamond burr, which will not remove any tooth structure axially. So connect the lingual and facial chamfer. You can use the fender wedge and flat diamond burr and end cutting diamond burr. And make sure to remove any J margins. Look at your prep from all angles. For the last steps, you want to refine and polish. Make sure you have no J margins. This is where you have a lip. So what you can do is grab your Explorer and everywhere you see an arrow, go from the tooth and away from the tooth to the cavo surface and make sure it's perfectly flat. There should be no clicking noise, no J margin, no elevation of the tooth. It should be perfectly flat. If it's not, use the end cutting diamond burr to flatten it. With these diamond burrs, there are diamonds on the very edge of the burr where it's flat, but it will not cut the rest of your crown prep. To check for undercuts, close one eye, and you should be able to see the entire crown prep 360 degrees around. Nothing should disappear. In red, I marked on this prep, so you can trace all of these lines on your crown with the tip of your Explorer or the tip of the perio probe from incisal edge and run it all the way down to the chamfer. The tip should not disappear at any point. If the tip disappears, that means there is an undercut and you need to refine the prep. So after checking for any refinements or touch-ups, such as making sure there are no J margins, checking for continuity of that chamfer, that you can trace it with the Explorer, facial to mesial to lingual to distal, that it all connects. It's all connecting. Checking for undercuts, checking all the reductions with the putty and the perio probe. Then you can polish. And then grade your own work. Self-assess and see if you would pass the exam and what areas you need to work on. Next topic. Now I will cover the bridge steps. Read every word of the manual. For the bridge prep, you will be prepping number 3 for a cast metal crown and number 5 for a PFM crown or porcelain fused to metal crown. Here is the criteria for the number 3 cast metal crown preparation. And here is the criteria for the number 5 PFM crown preparation. When prepping these teeth, make sure that the taper is between 8 and 12 degrees. Something that makes the bridge prep a little more challenging is making sure you have a good path of draw, also known as the line of draw or path of insertion, which is an imaginary line that guides the placement and removal of the bridge. What helped me to check for the path of draw was using the ortho mirror. I bought it on Amazon. Closing one eye and making sure I could see all of the axial walls that I had prepped of the 2 teeth from the same angulation. So instead of holding the little mouth mirror and trying to hold it in the same position and hovering it over these teeth, I could hold the ortho mirror at one angle, close one eye, and make sure I could see all the axial walls. 360 degree, I should be able to view on both teeth. If from one angle of holding that mirror, there were any areas that disappeared where I could not see the axial surface of the teeth, that meant I had to go back and prep some more because there were undercuts and I did not have an appropriate path of draw. What might give you a false sense of security is if you're holding the mirror and you don't see one spot and you move the mirror slightly and then you see that spot, that's not okay. You have to be able to see all the axial walls on both teeth holding the mirror from one angle. And then to double check that you don't have any undercuts, place the tip of the explorer or perioprobe from the incisal or occlusal surface and run it down all the way to the chamfer. And the tip should not disappear. If it does, there is an undercut. So after reading the manual, I wrote out all the dimensions on a drawing. Here is my drawing. If you can read my chicken scratch, feel free to take a screenshot. And then I wrote my checklist. Here's an up-close image of the checklist and the drawing. So we've already made the 3 putty matrices. First, you need to make sure that your typodont is in occlusion and inform the CFE if there's an existing open bite, as this can throw things off. Then you want to measure the burr thickness. We will be prepping 1 millimeter grooves in all the surfaces of teeth number 3 and 5, except number 3 and 5 lingual surfaces, which must be less than or equal to 1 millimeter. And when you create these depth grooves, I would not create 1 millimeter grooves because once you go to connect them, you will inadvertently make the entire surface slightly deeper. So we need to be careful with the lingual of 3 and 5. This is the sequence I followed. And again, anytime I prepped a surface, I seated the matrix, the putty matrix, and then would measure with the perioprobe. So I started by drilling the pits and fissures, followed by occlusals, linguals, interproximals, buccals, and then refined and polished. Here you can see I drilled the pits and fissures of 3 and 5. If you do not drill the pits and fissures, it's easy to under-reduce those areas of your prep. For the occlusal surface of number 3, the acceptable range for the prep is 1 to 2 millimeters of reduction, and for number 5, 1 to 2.5 millimeters of reduction. If in any area you have less than 1 millimeter, it is not acceptable. Occlusals. For the occlusal, I split it up into sections. Again, if you can read my chicken scratch, I have number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, going back and forth between the 2 teeth. This is the sequence I followed for prepping the occlusals. I know it looks overwhelming, but I'll take you step by step. Starting with number 3. Sink the burr 1 millimeter and prep the plane that I listed as number 1. Measure your reduction. Measure the entire plane. See, that wasn't so bad. That was number 1. Number 2. Measure. Number 3. Number 4. Again, after every prep, I am measuring. Tooth number 5. Prep surface number 5. Measuring. Number 6. And now for number 7. Number 7. Number 8. This is the part where we are prepping the functional supportive cusps. Number 9. and 10. Remember, when we're doing crown preps, we're making a miniature version of the tooth, following the anatomy. Number 11, number 12, number 13, number 14, number 15, number 16. Now we will prep the lingual surface, and for this we have to make sure it's less than or equal to 1 millimeter, so we'll be conservative. Anytime I do a crown prep, I like to hold the burr and do a practice run, like a dress rehearsal, making sure it's at the right angle, making sure my movements are unobstructed and smooth. So first, I'm just making sure I can access this properly. Again, you want to make sure that you're aware of the dimensions of your burr, how thick it is, and then for this, just sink half of the burr into the tooth for the depth cuts. Here you can see the depth cuts on number 5. I've already connected them on number 3. Depth cuts connected on number 5. Number 3, mesial, lingual, half of the tooth. Number 3, distal lingual, half of the tooth. And now the lingual is prepped on number 3. And number 5. Let's measure with the perio probe and the putty matrix. Run the perio probe, measuring all the surfaces we prepped. Okay, I've identified an area where I have under-reduced. It's less than 1 millimeter. So, if you see something like this, you have to refine the prep and then measure again to make sure you're in the acceptable range. For number 3, 1.5 millimeters of reduction on the occlusal is optimal, and for number 5, 2 millimeters is optimal per the manual. Don't forget to measure your crown preps from all angles with the various pieces of putty that we made. Running the perio probe along the tooth, checking your reductions, refining where you need to, rechecking your reductions. Okay, this is important. Always make sure you apply pressure on the putty. As you can see in the picture on the right, the putty is lifting off of the tooth. So if you were to measure here, you'll have an inaccurate reading. The picture on the left, I'm actually measuring with the perio probe while applying pressure on the putty along the occlusal surface. So anytime you're measuring your reductions, make sure that the putty is perfectly adapted and there are no gaps between the tooth and the putty on the parts of the tooth that is not prepped, or if the entire tooth is prepped, that the neighboring tooth or the adjacent tooth has no gaps between the putty and the tooth. You see this where I have the red arrow? Here you can see where the red arrow is that there's a gap. There's a space between the gingiva and the purple putty matrix. And then you can see I have 3 millimeters. It looks like I've over-reduced the occlusal surface. In this photo, you can see that there are no gaps between the part of the tooth that is not prepped and the putty, and between the gingiva and the putty. This will result in accurate readings of my reductions. Measuring, checking all surfaces. You have to use the mouth mirror to check the reductions of the distal half of number 3. Measuring, measuring, measuring again, measuring and finding that I under-reduced. Refining the prep. Checking the new reduction. Now we'll prep the interproximals. I place the fender wedge. Make sure the burr is parallel to the long axis of the tooth. Prep the interproximal. Fender wedge placed between number 2 and 3. Prepping 3 distal. Buckles. Making sure I have the right angulation of the burr parallel to the long axis of the tooth. Placing 3 depth cuts on the buccal surface and connecting them. Measuring the distance of the chamfer to the gingiva, making sure it's less than or equal to 1.5 millimeters. Measuring all around the tooth. Here you can see I under-reduced the buccal cusp tips of number 3. Make sure you don't have any sharp edges. Refine and polish. You may end up with a crown prep that has many sharp edges. I recommend checking the angles of the contours of the adjacent tooth and holding the burr along the surface and then carefully hovering that burr to the tooth you're prepping and then rounding off those sharp edges. Rounding the edges, making sure it follows the anatomy of the tooth. Rounding the sharp edges on number 5. Now with the ortho mirror, I am checking for undercuts and path of draw. Up close. We want to make sure we can see all the axial surfaces, the facials, buccal, linguals, mesials, distals of our crown preps. This is a drawing of the number 5 crown prep seen from the occlusal surface. As you can see here, the chamfer on the buccal must be between 0.5 millimeter and 2 millimeters thick or wide. And then on the lingual, it's supposed to be less than or equal to 1 millimeter. You can use your perio probe. The tip of it, if it has a ball at the end, should be 0.5 millimeter. You want to make sure that it's not a very defined transition going from how much you reduced axially on the buccal versus the lingual. And this should occur in the center of the tooth if you were to split it between buccal and lingual. Measuring. Smoothing some rough and sharp edges with a carbide football burr. I recommend polishing your crown and bridge prep. I like to use these Jiffy cups and discs and points. This will help get rid of any sharp edges. The Jiffy cups and discs and points leaves behind some debris, so afterwards I use a toothbrush and then an alcohol wipe to clean the surface. Checking the preps from all angles. You want your final product to look beautiful and presentable for the graders. Lastly, check the occlusion from the buccal. The occlusal reductions may look great on the putty, but not on the bite. So make sure there's adequate reduction. Checking from all angles. And practice. Every time you practice, ask yourself, how can I improve? Thank you for watching my video, and I really hope it helps you pass the ADEX exam, and good luck. If you're interested, check out my website where I post valuable student resources at williamjacobson.net. As mentioned, I'm the author of Clinical Dentistry Daily Reference Guide. I wrote this book to help dental students and dentists by providing real-life, practical, relevant clinical material. And it's a book I use in my practice. I have an entire chapter dedicated to crown and bridge where I cover topics such as treatment planning, knowing when to select the right crown materials, such as the advantages and disadvantages of zirconia versus base metal PFM versus lithium disilicate, and so forth. I provide you with the crown material prep guidelines so you know how to prep these teeth based on the type of crown that you're selecting, with advice on shade selection. I also provide very detailed information for the procedural steps for crowns, bridges, adjusting crowns and bridges, sectioning crowns and bridges. At times you have to do this, and extract teeth, core buildups, post and cores. I remember being confused as to what to write in lab prescriptions to communicate with the lab technicians, so I provided lab prescription templates for you. I also provided post-operative instructions so you know exactly what to tell your patients to reduce complications, along with visit note templates, clinical pearls, and so much more. My book, Clinical Dentistry Daily Reference Guide, is available on Amazon, so I hope you check it out. Thanks again for watching.